Chapter 6, page 167. Reading, Culture and Mental Illness. Society has long placed labels on people who display abnormal behavior, labels such as crazy, insane, neurotic, psycho, strange, possessed, and nuts. Unfortunately, most of the time these labels have reflected the intolerance of the people using them and have been used with little thought as to what the label signifies. Finding appropriate and specific names and classifications for abnormal behavior has been a major challenge for psychologists. It is difficult simply to distinguish normal from abnormal behavior, yet classification systems are necessary. Over the years, many classification systems have been used. Today, the standard system created by the American Psychiatric Association is used by most professionals in the United States to diagnose and classify abnormal behavior. This classification system is the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, the DSM-4. However, what is regarded as a symptom of mental illness in one society may be just one aspect of a normal, healthy life in another. In most people's view, a person who hears voices of the recently deceased is probably a victim of some psychological disturbance. Yet members of the Native American Plains Indian tribes routinely hear the voices of the dead calling to them from the afterlife. This is only one example of the role that culture plays in the labeling of behavior as abnormal. In fact, of all the major adult disorders listed on the DSM-4, just 4 of them, schizophrenia, bipolar disorder, major depression, and anxiety disorders, are found across all cultures of the world. Take, for instance, anorexia nervosa. This is a weight disorder in which people, particularly women, develop inaccurate views of their body appearance, become obsessed with their weight, and refuse to eat, sometimes starving in the process. This disorder occurs only in cultures which believe that slender female bodies are most desirable. In countries where such a standard does not exist, anorexia nervosa does not occur. Interestingly, it is a fairly recent disorder. In the 1600s and 1700s, it did not occur in Western society because the ideal female body at that time was a plump, somewhat fat one. Similarly, dissociative identity, multiple personality disorder, is only seen as a problem in societies in which a sense of self is fairly concrete. In places like India, when an individual displays symptoms of what people in Western society would call multiple personality disorder, in which one person has more than one separate, distinct personality, it is assumed that this individual is possessed by demons, which is viewed as a problem, or by gods, which is not a cause for treatment. Other cultures have disorders that do not appear in the West. Amok is a mental illness found in Malaysia and Indonesia that has a specific set of symptoms. It is characterized by a wild outburst in which a person who is usually quiet and withdrawn kills or severely injures another person and doesn't remember the murder, experiencing complete amnesia afterward. Some researchers consider amok a disease specific to these cultures, while others consider it a form of depression psychosis produced by extreme stress. English gets the expression to run amok from this mental illness of Southeast Asia. It has been pointed out that amok occurs in societies where individuals also may go into a trance. A suggested explanation for amok in Malaysia is that it may be an extreme expression of aggression in a society which strictly prohibits such expression. In Algeria, a sick person is believed to be possessed by jinn, spirits, and this is considered to be a form of madness. People believe that someone else, motivated by envy, will use the evil eye. This causes the victim's behavior and desires to come under the control of supernatural beings. The marabou is one type of traditional therapist who treats such patients. In an exorcism, the marabou talks with evil spirits through the patient. The use of traditional therapists like the marabou are not only legal, but on the increase in Algeria. In countries like Iraq, Kuwait, and Tunisia, such therapies are illegal because they are associated with underdevelopment, in contrast to modernization. Some West African men develop a disorder when they first attend college that they call brain frag. It includes feelings of heaviness or heat in the head, as well as depression and anxiety. Finally, ataque de nervios is a disorder found most often among Latinos from the Caribbean, characterized by trembling, crying, uncontrollable screams, and incidents of verbal or physical aggression. In sum, we should not assume that the DSM-4 provides the final word on psychological disorders. The disorders it includes are very much a creation and function of Western cultures at a particular moment in time, and its categories should not be seen as universal.